Now, the Singapore government will continue to pay the medical bills of children aged 12 and below if they are infected with COVID-19, regardless of vaccination status. Education Minister Chan Chun Sing says there are also no plans to make vaccination a requirement for them to attend school. He says the focus is ensuring children are well protected against COVID-19 as vaccinations begin. Over 123,000 children aged 5 to 11 have received at least one vaccine dose or have booked appointments. While vaccination-differentiated measures will not be applied, Mr. Chan did not rule it out for higher-risk activities.
We would very much like to have all our children be able to attend school and participate in as many of the core activities as much as possible. Now, having said that, of course, there are also activities beyond the core curriculum that may pose a higher risk to our students. And for those higher risk activities, we will then have to consider if differentiated measures will be required. For example, students participating in the playing of wind instruments or the choir, and 2, students participating in sports activities that may require physical contact.
A senior Minister of State for Health, Dr. Janil Putacheri, says it's not necessary for children to go for a medical review before their jab. That's after a question was raised on this, as some adults with underlying medical conditions were advised to do so in the early days of the country's vaccination drive.
We took that approach in the early stages of the adult vaccination drive because at that time the amount of data that we had was less, the amount of experience that we had was less, and now we know a lot more about both the disease as well as the vaccination, including in children. So the approach for children is not so different from adults. If they have an underlying condition, and there's a list the doctor will know about, then some review needs to happen.
For now, only mRNA vaccines are approved for use for children below 18. Special exemptions were made for those who are medically unsuitable for these jabs to take Sinovac instead. Under this program, only those aged 12 to 17 can do so. The Health Ministry is reviewing if this program can be expanded to those 5 and older.